Good day, everyone. It's an honor to be here today for this webinar hosted by Jetema. My name is Dr. Edmond Lau. I'm an aesthetic physician based in Penang, Malaysia. And today my topic is about hyaluronic acid filler rheology and demonstrating how understanding the science of filler rheology can elevate our practice to create a true masterpiece using dermal fillers. Right? So, hyaluronic acid is a cornerstone in aesthetic medicine. Hyaluronic acid is the most commonly used filler material because of its ability to hydrate, volumize, and shape the face. Its proven safety record, effectiveness, as well as reversibility has made it popular among doctors and patients. By modifying hyaluronic acid molecule with the addition of cross-linking agent such as BDDE, manufacturers are able to create a gel material that lasts longer and create products that have different physical consistency. Different types and brands of hyaluronic acid fillers are produced using unique proprietary processes specific to each manufacturer. While these production techniques can greatly impact the gel properties, shaping how it behaves in tissue and ultimately influencing patient results, the process are often trademarked, giving us limited information into how the filler will actually perform once injected into the skin. This also makes it difficult to predict the outcome of different brands of hyaluronic acid fillers. Well, it's like comparing an apple to an orange when you compare different brands of fillers because they are made very differently. So, sorry. Okay, when deciding to purchase a car, whether it is a sport car, a 4WD, or an ordinary sedan, we can look at standardized specifications like the horsepower, the fuel efficiency, or the safety ratings. These specs provide clear and measurable data on the car performance to help us make an informed choice based on our needs. With hyaluronic acid fillers, we also need products that have different specs and performance. This is because fillers placed in different areas of the face or different planes are subjected to unique forces which influence the overall clinical outcomes. So this force includes the compression, the shearing force, the torsion, as well as lateral shearing. With our growing understanding of facial anatomy and how aging influences the facial bone and structure and fat pads, facial filler treatment today should go beyond just providing volume. They shouldn't be confined just to simple categories like soft fillers, medium fillers, or hard fillers. To achieve optimal outcome for our patients, we need to familiar with the key physical properties of these fillers that we use. These properties includes filler rheology, cohesivity, as well as the degree of modifications. So what is rheology? Rheology is the study of how metals behave when force are applied to it. Essentially, how it deforms and flows. For us in aesthetic medicine, it is important science that help us predict how filler will behave once injected into the skin. There are 4 key rheology parameters important to us for us to know. Number 1, it is the complex modulus. Number 2, elasticity. Number 3, viscosity. And number 4, the tan delta. Now, let us look into complex modulus. It is the measure of the filler's overall resistance to deformity. It can be calculated by combining both the elastic as well as the viscous properties of the filler using this particular formula here. So, in another word, complex modulus tell us about the product hardness. A product with high complex modulus is like a brick that is very hard, while a product of filler with low complex modulus is like a jelly or ice cream, which is very soft. Next, we have the elasticity, or commonly referred as the G prime, or also in physics terms, the storage modulus. G prime reflects the filler ability to retain the shape following a shear force. A high G prime means that the filler is more elastic and is able to spring back when subjected to shearing force. A shearing force is the force that oppose each other in two directions. For example, a jello here have a higher G prime compared to an ice cream because it is able to spring back to its original shape when the shear force is being applied. In contrast to popular belief, G prime is not a direct measurement of tissue projection ability, right? So that is very important. Another measurement for elasticity is actually E prime, which is less popular. E prime reflects the filler's ability to retain its shape following a vertical compression force. A higher E prime means that the filler is more elastic and able to spring back when subjected to a compression. For example, a jelly here have a higher E prime compared to an ice cream because it is able to, sorry, I think the slide jump. Okay, a jelly here has a higher E prime because it is able to spring back when compression force is being applied, compared to an ice cream where it's not able to spring back. Now, let's talk about viscosity. Viscosity, also known as loss modulus. The viscosity often symbolized as G double prime. And it tells us about how easy a material flows. Filler with lower G prime are smoother and tend to flow sideways more easily compared to filler with higher viscosity that is able to resist flow. One example is comparing a hair wax and honey, where hair wax exhibit high viscosity, it doesn't flow sideways, while honey or water exhibit low viscosity. Mainly, viscosity determines the extrusion force of a filler. A filler with low G double prime tend to be easier to inject, while a filler with high G double prime tend to be harder for us to inject. Now, most importantly, after knowing what is G prime and G double prime, we need to put them together, and that's what we talk about is tan delta. So tan delta is the ratio of G double prime to G prime. So tan delta indicates whether the filler behaves more like a solid or a liquid. A lower tan delta means that the filler will behave more like a gel, and conversely, a higher tan delta means that the filler is softer and behave more like a fluid or liquid. So because HA fillers are used for volume replacement and facial contouring, these fillers needs to be mainly elastic. It needs to be in a gel form. Hence, their tan delta are often less than 1. So if you think about it, if a filler is further away from 1, for example, a tan delta of 0.2, it will show a product that is more elastic and more stronger compared to a product that is closer to 1, which is like 0.6. So 0.6 is closer to 1, and hence it tends to spread sideways much more easier. All right. A product with lower tan delta should be injected deeper into the structure for supports, while a product with higher tan delta, closer to 1, can be injected more superficially to treat facial wrinkles. Products with higher tan delta are also preferred for areas with thin skin, such as the under eye as well as the forehead region. Skin booster, which is popular in this case, hyaluronic skin booster, with cross-linked hyaluronic acid, designed for superficial injection, should have a tan delta close to or more than 1. This is to avoid prolonged lumpiness post-injection. Now let's talk about cohesivity, another important properties of hyaluronic acid filler. Cohesivity refers to a material ability not to dissociate or not to separate or break apart. In other words, it's a tendency to stick together and maintain its form. Cohesive filler is important to reduce the risk of product migration as well as to improve the duration of the results. So, besides just G' and E' of a filler, the cohesive property or the cohesivity of a filler plays an important role in determining the projection capacity of a filler. A cohesive filler, when it's subjected to various forces, keep its shape and maintain the tissue projection. On the other hand, low cohesive filler will tend to break apart and loses its projection capacity. Right. So this is an experiment, or this is a paper published showing that although, let's say in here, gel V has a higher G' compared to gel D, but because gel D is more cohesive, at same amount being injected under the skin, gel D actually exhibit higher projection capacity compared to gel V. Hence, this experiment again shows that G' does not directly correlate to, it correlates, but does not, it's not the only factor that determines the projection capacity. So, factors that influence the cohesivity of a filler material includes the hyaluronic acid concentration, the molecular weight of the HA being used in the production, as well as the cross-linking process. Filler that uses high molecular weight or long-chain HA are generally more cohesive than filler with short-chain hyaluronic acid. This is due to the natural bivalent ionic bonds between the hyaluronic molecules. The use of more cross-linking agents in the process of producing fillers does not make the filler more cohesive. So, addition of more cross-linking agents, in other words, actually, what we call the higher degree of modification, actually may result in a more rigid or harder gel that resists biodegradation and reduce biocompatibility. High MOD may result in a filler that lasts longer than we expected. Recent MRI studies have shown that some filler material injected into the mid-face are still detected 15 years after being injected. So, although hyaluronic acid molecules is generally regarded as a low immunogenic substance, product with high degree of modification may result in a product that is more immunogenic and may result in more substantial foreign body reaction and granuloma formation in years to come. Having said that, BDDE is still a time-proven safe cross-linking agent that can be used to maintain product longevity. However, it is best to use a filler with the least MOD or degree of modification and yet is able to perform well in terms of longevity and rheological characteristic. Hence, to summarize, instead of picking our product based on marketing or popularity, we can choose our dermal fillers by evaluating cohesivity, MOD, as well as its rheology property. So, depending on where and how we want to use our dermal fillers, we can choose the filler with the right rheology characteristics. So, for example, for the forehead, we need a product that is moderately cohesive, low to moderately elastic, and moderate to high tan delta. This is so that the product can spread evenly and does not create lumpiness over the forehead because of the thin skin. For the nose, we need something that's high cohesive, high elastic, and low kangalka because we want something that projects well and stay in place. For lips, again, we want something that is moderately cohesive, low elasticity, and low kangalka because, again, what we want is a product moderate to low kangalka because what we want is a product that doesn't break apart because the lips is a constantly moving, is a high mobility area, and we need something that is also soft as well. For chin, again, similar to the nose, we want something that's highly cohesive, high elastic, and low kangalka. We want something that projects very well. So again, temples, we can inject in several layers. So for temples, if we are injecting deep, we need something that's highly cohesive to make sure that filler stays in place. Filler that has high projection capacity, high elasticity, as well as a low kangalka. Whereas if we are choosing to inject more superficially, for example, interfacial plane as well or the subcutaneous layer, then we might choose a product that has moderate cohesivity, a product that is a little bit softer with elasticity, lower elasticity, and a product that has higher kangalka so that it doesn't create lumpiness over the thin skin area. For subzygoma, on the other hand, product that is moderately cohesive, low to moderate elasticity, and higher, moderate to high kangalka. Again, because for subzygoma, we often inject at a subcutaneous plane, so we should choose a product with moderate to higher kangalka. For the jawline, we need something that's cohesive, that projects well, and low kangalka, and as we inject deeper. For piriform fossa, again, we want something that projects very well and stay in place. So a product that has high cohesivity, high elasticity, and lower kangalka. For nasolabial fold, at this area, often we inject more superficially using a cannula. So a product that has moderate cohesivity, elasticity moderate, and kangalka a little bit more moderate, so that it's not too hard that you can feel under the skin. For mirror lines, you want something that is moderate to high cohesivity. The reason why the high cohesivity is important because, again, this area is a hypermobile area. Hence, you do not want product to migrate elsewhere. Product that is soft, moderately soft, elasticity should be moderate, and kangalka should be moderate. For under eye, you want something that is moderate cohesive and something soft with high kangalka so that over this thin skin area, there's no lumpiness or nodule form, right? So next. Now, I would actually like to end my presentation with a case sharing using e.p.t.q filler. And this e.p.t.q filler is a filler with low degree of modification. And in this particular case, I use 3 SKU from the e.p.t.q filler range, which is the S100, the S300, as well as the S500 range, right? So S500 is the highly cohesive filler with higher complex modulus, giving the best tissue projection and should be placed in a deeper plane, while the S100, again, is a cohesive filler with the highest kangalka. It means that we can place it most superficially to blend in the skin wrinkles. Okay, so here I have a 42 years old lady with significant facial volume loss as well as a prominent mandibular prognathism. Okay, you can see the mandible is protruded and there is a receding chin. She has a volume loss over the forehead region, right? And that the superbrow as well as the temples, there is also significant volume loss. There is depression over the subzygoma area, as well as a very flat mid-cheek as well. And the proportion of the lower and upper lips is also not proportionate, being that there's a more volume over the lower compared to the upper lips as well. So this is what I did for her. So for the lateral forehead, for the suprabrow area, I injected S300 0.4 cc using a 23 gauge 50 mm cannula at the supraperiosteum plane. For the temple, I decided to use two-plane technique, where I went in with the S500 1.1 cc per side using a needle 25 gauge on the bone technique, and subsequently I fanned out S300 e.p.t.q 0.7 cc using a 23 gauge 50 mm needle at the interfacial plane to fill up this very sunken area. At the restore space nasolabial fold, I injected 0.3 cc of S500 to give the tissue projection and to improve the nasolabial fold using a 25 gauge needle. Sorry, it's a 27 gauge needle. There's a typo there, right? And nasolabial fold, I injected S100 over this area using a cannula, 25 gauge cannula. And for the anterior cheek area, I injected 0.3 cc S500 over the deep fat plane. For the subzygoma area, I injected S300 1.3 cc each side using a 23 gauge 50 mm cannula at the subcutaneous plane using the fanning technique. And for the upper lips and the future ridge, I injected S300 totaling of 0.6 only over the upper lips area. In total, I used 10 cc of HA filler for this particular patient. So we can notice that this is the before and after. This is taken 2 weeks after. You can see that there is a significant improvement over the temples region, the suprabrow region, the chin. She looks more softer, more relaxed as well. And of course, we still preserve her natural look without over puffing her face. From the side profile view, we can see that the contour is improved. We can see that the suprabrow and the area, the contour is improved. We can also see that the subzygoma, the cheek contour is also improved, as well as we have improved the chin contouring as well, making her more softer, less angry looking. We have also improved the lips, improving the thickness of the upper lips, as well as give her a little bit of this filter margin. Right, so this is her. And this is the volume. So we have improved the volume for her face. The green color shows where the volume improvement is, basically. Okay, so to wrap up, understanding of concept of filler rheology is essential for achieving better outcome and minimizing complication for our patient. By considering the key rheology parameters such as elastic modulus, elasticity, viscosity, tan delta, and cohesivity, we can make informed decision about which filler to use for specific indication and facial areas. So most importantly, while many rheological data is not always readily available, and there is still a lack of standard measurement or reporting across brands, this should not deter us from making an informed decision. As doctors, we must strive to use all the data available to us. For example, any clinical studies, product characteristics, or expert knowledge. Ultimately, while we are artists creating masterpieces on our patients, the foundation of our choice for dermal fillers must be grounded in science. It must be evidence-based. Hence, combining both science and art, we can deliver predictable, safe, and beautiful results that enhance the patient's natural beauty. So with that, I thank you for your attention. Pass back to Dr. Ali.